We often joke about the differences between men and women, but when it comes to health issues, it's no laughing matter. Once again, here's Lorene Cachola with a look at how heart attack symptoms differ between the sexes and how understanding those differences could mean the difference between life and death.
A squeezing pain or pressure in the center of the chest, pain spreading through the shoulders, neck, or arms, an increasing heart rate. More than likely, you're experiencing a heart attack. You know what to do. Call 911. That's an unfortunate scenario for many men today. But if you're a woman, Dr. Stephen Gubin says you could be experiencing the same life-threatening issue and not even know it.
Women often have what we call atypical symptoms. They might not have any chest pain. They may have just some shortness of breath, just sweat. They may get sweaty. They may have fatigue, indigestion. They may just have some arm or jaw discomfort.
Add to that the fact that many women take on the role of family caretaker or doctor mom, and that can cause some women to minimize any symptoms they may be experiencing. For Joyce Stawitsky, that situation hits pretty close to home.
When my second grandchild was born, when I leaned down to pick him up and come back up, I would be just really short-winded, but I never really thought much about it. But it just kept getting a little bit worse all the time.
Bad enough that Joyce went to see her doctor, and he ordered a stress test.
I had had all the full workup, the x-rays and everything, and they said nothing showed up. So I thought, I was just doing good.
What did raise some red flags was a CT scan that detected calcium in Joyce's coronary arteries. Doctors performed a heart catheterization to see how much damage had been done. The results were worse than Joyce could have imagined.
She was found to have multi-vessel coronary disease and actually underwent a 5-vessel bypass.
I knew something wasn't right, but I just didn't know what, because I'd never really felt bad as far as just the shortness of breath. I never felt sick in any kind of way. I was just so thankful that somebody knew what they were doing when they found it, because otherwise I would never have known, and I would just go on with my life like I was doing, and I would have eventually had a massive heart attack.
Thankfully, Dr. Gubin caught Joyce's heart disease in the nick of time, but the message from the medical community is to spot the warning signs even earlier. You can do this by being aware of the risk factors.
Tobacco abuse, hypertension, diabetes, hyperlipidemia. And I think if you have some of these risk factors, if you treat them aggressively, it can go a long ways in preventing your risk of a cardiac event.
A healthy diet and exercise are also big parts of the daily regimen to keep this grandma on the go.
I have 2 grandchildren, 2 boys, and boys are pretty active. We play ball together. We do a lot together. It keeps you active. It keeps you young at heart. And that's why I want to stay healthy, so I can see them grow up.
For Smart Medicine, I'm Lorene Cachola.